A shocking decision just rocked the medical world, and it's leaving parents everywhere wondering if they can trust vaccine recommendations for their newborns. The Centers for Disease Control and Prevention's Vaccine Advisory Panel has just delivered an unexpected blow to those expecting major changes in how we protect babies from hepatitis B. In a surprising turn of events this Friday, the Advisory Committee on Immunization Practices chose to shelve a highly anticipated vote that could have fundamentally altered when infants receive their first hepatitis B vaccination. But here's where it gets controversial. This wasn't your typical committee decision. The 12-member panel, entirely handpicked by Health Secretary Robert F. Kennedy Jr. within recent months, found themselves in an unprecedented situation. Many of these newly appointed advisors have publicly questioned vaccine safety and effectiveness, setting the stage for what many anticipated would be a groundbreaking policy shift. Currently, medical professionals administer the hepatitis B vaccine to newborns within their first 24 hours of life. The proposed change would have pushed this timeline back significantly, delaying the initial dose until babies reach at least 1 month of age, but only when mothers test negative for the hepatitis B virus. And this is the part most people miss. Hepatitis B isn't just another childhood illness. This incurable infection wreaks havoc on the liver, potentially leading to severe liver disease, cancer, and ultimately death. The virus can silently transfer from infected mothers to their babies during the birthing process, making early protection absolutely critical. The political tension surrounding this issue has been building for months. Republican lawmakers, particularly Senator Rand Paul from Kentucky, have been challenging the medical rationale behind vaccinating newborns when their mothers show no signs of hepatitis B infection. Their argument? Why expose healthy babies to potential vaccine risks when the threat seems minimal? Dr. Robert Malone, serving on the ACIP panel, acknowledged on Thursday that the committee felt compelled to address these concerns because a substantial portion of Americans harbor serious doubts about current vaccine policies, especially regarding birth-time hepatitis B shots. However, public health professionals across the nation are scratching their heads, questioning why such a significant vote would even be considered without fresh research data to justify the change. Just minutes before abandoning the hepatitis B discussion entirely, the committee unanimously agreed to recommend universal hepatitis B testing for all pregnant women. A Department of Health and Human Services representative clarified that insurance programs already cover this testing, and the vote aimed to motivate healthcare providers and medical facilities to boost their screening rates. During Thursday's presentations, CDC researchers shared compelling evidence from 17 comprehensive studies demonstrating that hepatitis B vaccines maintain an exceptional safety profile while virtually eliminating hepatitis B infections in newborns. The agency also highlighted a crucial gap in current healthcare practices. Many pregnant women in America never receive hepatitis B screening, making it impossible to rely solely on testing results to determine which children need vaccination. The numbers are startling. Between 12% and 16% of expectant mothers in the United States never undergo hepatitis B testing during their pregnancies. Even when testing occurs, some infections slip through undetected. But here's where the meeting took a contentious turn. Several ACIP members launched pointed criticisms at the CDC's presentations, claiming significant information was deliberately excluded. They referenced individual studies and personal accounts suggesting potential neurological developmental complications from the vaccine. Two committee members, Dr. Robert Malone and Vicki Pepsworth, both with documented histories of spreading vaccine misinformation, accused the CDC of ignoring a crucial 2012 Institute of Medicine report. This report stated that researchers couldn't establish whether hepatitis B vaccines cause brain inflammation because no studies had adequately investigated this critical question. Simply because we lack statistical evidence proving a product isn't safe doesn't automatically mean the product is safe. Malone declared Friday morning. Pebsworth raised additional red flags about CDC data revealing irritability and fussiness in some vaccinated infants. We cannot dismiss these reactions as insignificant, Pebsworth emphasized. However, medical experts point out that attributing such common infant behaviors to vaccines proves incredibly challenging, since babies naturally experience irritability and fussiness regardless of vaccination status. Dr. Cody Meissner, a seasoned pediatrician and the sole current ACIP member with previous committee experience, firmly challenged Pebsworth's concerns. He argued that irritability and restlessness absolutely cannot serve as objective measures for evaluating safety. Meissner emphasized a fundamental principle: no vaccine achieves 100% safety or effectiveness, but the committee's responsibility involves determining whether vaccination benefits outweigh potential risks. When we examine newborn hepatitis B vaccination through this lens, there's absolutely no doubt that the benefits dramatically exceed any possible adverse effects, he stated. The historical evidence supports this position powerfully. After the CDC introduced universal birth dose recommendations in 1991, acute hepatitis B infections among children dropped dramatically. Whether ACIP will revisit this contentious topic remains uncertain. Should they choose to do so, representatives from the National Foundation for Infectious Diseases, American College of Physicians, and Society for Adolescent Health and Medicine have urged the committee to return to their established, evidence-based framework for vaccine recommendations. This time-tested approach carefully weighs vaccine risks against benefits while considering implementation feasibility and health equity implications. Dr. Amy Middleman, representing the Society for Adolescent Health and Medicine, warned against getting sidetracked by contradictory research findings. I strongly encourage the committee to embrace systematic, scientific methodology when properly evaluating risks versus benefits, she advised. So here's the million-dollar question that's dividing medical professionals and parents alike. Should we trust decades of scientific evidence supporting early hepatitis B vaccination, or do the concerns raised by these committee members warrant a complete reevaluation of our approach to protecting newborns? What's your take on this controversial decision? Do you believe the committee made the right choice by delaying this vote? Or should they have proceeded with potentially changing vaccination guidelines based on the concerns raised? Share your thoughts. This debate is far from over, and your voice matters in shaping how we protect our most vulnerable citizens.